indigenous people of the state. Above and beyond that, I am also on the CARE program, which is the Rural Health Equity Program through Dartmouth Hitchcock. I'm a board member for that. So I participate in those meetings as well. I dabble in so many different things, in legislative issues. I'm a federal religious advisor. The list goes on and on. But I want to welcome you all for taking, as Tori said, taking the leap of faith and joining us. And I really am looking forward to having you all as part of the board and working together to create even a better health association for everyone.
Amelia,
Yeah, sure. Happy to introduce myself. Great to meet you, Denise. I feel like I've seen you in passing, so it's nice to hear a little bit more about you as well. And Tori, great to see you again. I'm Amelia Pullman. I am the New Hampshire Disability and Health Program Manager. So I work at the Institute on Disability at UNH. We're under the College of Health and Human Services here. My primary work is on a big CDC project that focuses on the health and wellness of adults with disabilities in New Hampshire, specifically adults with mobility disabilities and adults with intellectual and developmental disabilities. But I also lead a small project that's funded through the National Center for Health, Physical Activity, and Disability, where we partner with the Granite YMCA to um, identify gaps in inclusion with their branches. We're specifically focused on Manchester and Goffstown right now. So doing some really exciting work with a group of folks who are involved in disability, folks who are involved in health, and then also in that intersection to do that project. So that kind of what brings me is interested in the board and interested in the association. So happy to be here.
thank you so much and welcome, welcome. Tochi.
Hello, everyone. So good to be here and be part of this. I have a background in public health, and by way of that is through experiences that I have engaged in community service, not just here in the United States, but also in Nigeria and Africa. And then I've also, as much as possible, entrenched myself in so much community work that I got interested even back home to do a master's degree in public health. And so having done that and even doing that, I did a couple of research during COVID, and then also try to participate with lots of community members within my community in Texas and then Louisiana before I moved down to New Hampshire. And then when I got here, I was also interested in doing public health. I really wanted to be a part of what was happening in my community, where I was residing with my husband. And so I was like, where's a public health association that I can be a part of? And so that was how I got to know about this community, and I wanted to be a part of it and just continue the work that I've been doing, volunteering and then giving back as well, and just being a part of my community. And so that's why I'm here, currently a program manager with Manchester Community Resource Center, which is an affiliate of Department of Health and Human Services. I'm managing the programs within the four, or would I say five satellite offices that we have in New Hampshire. So obviously do more work with Public Health Association and also just be part of the work that has been done in New Hampshire as a whole. Thank you for having me. I'm unable to hear you, Tori.
Oh, sorry. Rich, are you available to chime in and introduce yourself?
Yeah, can you hear me?
Yes, we can.
Yes, we
Oh,
can.
good. I know you can't see me. I don't know why I can't see me, but that's okay. Um, just interesting. I'm just about ready to celebrate my 50th year as a public health professional, coming up later this month. I'm a founding member of the New Hampshire Public Health Association back in the 1980s, when it was in its infancy. I have a long career in public health. I won't go through all of it, but having served as an assistant director of public health with the New Hampshire Division of Public Health Services and chief of communicable disease epidemiology, and Deputy Director of Public Health in Manchester, as well as Chief of Environmental Health and Director of a local health department in New Connecticut, and also a retired Air Force officer as a public health officer with the New Hampshire Air National Guard, and a former state representative, 4 years in the state house as a state rep on the Health and Human Services Committee. So, and I'm a former member of the New Hampshire Public Health Association, so board. So, looking forward to participating. I think this is going to be more than an exciting few years ahead of us in terms of dealing with public health issues. Some of it we probably wish we didn't have to deal with, but I'm sorry, we'll probably have to. But we may have some important input to contribute to the for the continuation of good public health in New Hampshire and in the country. So thank you.
Thank you, Rich. And yeah, that is the most condensed version of a phenomenal resume I think you could possibly come up with. And I'm really looking forward to more opportunity to have you share those experiences. And I will let folks know that I grew up in the area of the state where Rich did a lot of work. And this feels a little dorky to admit, but there were times where I was reading his letters to the editor or to the newspaper, and it was the only time I can ever recall talking to the newspaper, like in my lap. Yes, yes, what he said. There were a few times, Rich, where I was so in agreement with what you said that I spoke to my newspaper. Before social media, I think, but it happened. So I'm really excited for this, what we would consider a slate of new folks coming in. Want to just kind of take you through our organization as I understand it today, and Denise can speak to kind of the time before, and then Rich, it sounds like, can speak to any intention at birth. But where I want to start is at something that I use with my students that I think is helpful when we have such a expanding and wonderfully diverse idea of public health today. When I was in nursing school, public health was on the third floor of the building the nursing program was in, and that was my understanding of public health. It was a department, it was a program. I didn't really understand that anybody anywhere was touching public health the way I understand it now. So this feels very representative of our experience through COVID, and now to Rich's point, it feels appropriate for what sort of excitement we might be seeing coming down the pike. So just want to acknowledge and my appreciation for everyone's diverse experience and perspectives. And one of our goals is to recognize and celebrate that. It's not a formal part of a strategic plan, but it is part of our culture. So we do talk about what is public health, and folks here all are experienced public health competent, so I won't spend much time on this. It's the sort of discussion that Denise has helped craft because we have other board members with limited formal public health experience or training, but extensive and exciting roles that are public health centered or public health adjacent, including running an organization that supports folks who are new immigrants, UNH's cooperative extension program in youth and or health and wellness. We have a CPA on the board, retired MD. So again, a broad swath of folks with similarly broad experience and skills. We'll skip that one. So New Hampshire Public Health Association's mission, in case the website was down for a little bit, it's back up now. We've migrated to a new server, so it's still under development, but these are the essentials and the things that we try to keep in mind as we do our work, that we are first and foremost a member-driven organization. It is a continual process to define what that means because our membership has changed and will continue to change. That we champion public health policy. Public health policy is a very broad term now. It includes social determinants, political determinants. It includes many of the traditional behavioral health, physical health, emotional health concepts. So environmental health. There are a lot of ways to define public health, and we don't drill down to a specific definition. Workforce focused, that is part of the mission, and it's also part of the leading efforts in New Hampshire in recent years, because we are finding that many of our traditional healthcare providers are impacted in their ability to do good work by workforce challenges, which are impacted by things that impact the population in general, right? Wages, the economy, access to housing. So the public health workforce is a microcosm of the larger state workforce. So we are really embracing our role as conveners, as collaborators, as an organization that encourages connection and sharing of information and resources. NHPHA's vision is to become that trusted entity that helps our members be informed and literate about issues that are important to them, especially around issues that require decision making or may have a more broad swath of perspective, really focused on evidence-based, science-based, and what do we know, fact-informed things about policies and practices and programs. So always working towards a more equitable experience for folks in New Hampshire, and that includes visitors and residents as well. So we have a mission, we have a vision. The next conversation is about, well, how do we walk this talk? Identifying a set of values, of guiding principles. That's a pretty common approach for building strategic plans around. So we do have some that you should be able to see these reflected in the mission and vision, right? So that's kind of if you see these values in the mission and vision, then we're doing our work, thinking all of the way around. We say we do this, our goal is to accomplish it this way, and these are the things that we hold most dear and important as our guiding principles. The board's role is to help make sure that the way we approach fulfilling that mission and vision is accountable to those values, right? There are some technical responsibilities that the board has, and there are some cultural responsibilities that the board has. And that's really what today's overview and orientation is designed to kind of address. It's not a deep dive, it's more a survey. I didn't ask folks about their previous experience serving on boards, but let's just assume it's fair to middling, because in my experience, every board is different. So I want to make sure that we talk about how NHPHA views the board role. So the board is that entity that has overall responsibility for the existence and the compliance with rules of an organization. How is it governed? Who's in charge? How are decisions made? And what is the primary work? And that's mostly as defined by the IRS, because we are a nonprofit. There are for-profit entities that have boards. They are governed differently, and they have different responsibilities and different duties. So we're going to cover nonprofit roles, responsibilities, and duties as New Hampshire kind of expects us to behave, essentially. Everybody on the board is responsible for the same stuff. Everyone's voice is equal. In the NHPHA board, we do not have an executive committee. We have some new subcommittees or committees, but the board as a whole, one person, one vote. Regular meetings and minutes, and basically acting as the supervisor of the director, of the executive director, which is me. NHPHA has had other staff at various times, depending on the grant funding that we received. Managing those folks is my responsibility, or the executive director's responsibility. It is the board's role to supervise, manage, guide, coach, mentor, from an organizational perspective, the director role. New Hampshire lays out a pretty clear, maybe it's not so clear, but a pretty comprehensive set of expectations for nonprofits. I will send this out, and that document is linked in here. It's generic, but it does go into more detail about what New Hampshire's reporting and regulatory requirements are. And they're not onerous, and they're not different from other state requirements for nonprofits, because they are primarily driven by the IRS rules for nonprofits, which are the same across the country. There are 3 duties that board members have. The duty of care is the first, and that basically means do the right thing. Like most folks, it's almost the Family Feud. What would the average person say was the right choice or the right perspective in the context that the board is working within? In action items, this means being prepared for meetings, reading the materials, understanding the pieces and the elements and variables and factors involved in votes, reviewing the financial report, and just maintaining a awareness of that the organization is current, up to date with reporting to the IRS, the state, any other funders. So duty of care is the equivalent of making sure that the work is getting done as it has been stated it will be done. The second is the duty of loyalty. This is primarily around financial benefits, and really the role of the board is to make sure that no staff member or board member gets what they call a pecuniary benefit, which means some advantage that is not available to folks who aren't on the board or staff financially. And the state says, if there's a transaction or exchange up to $500, that's all right. You just need to acknowledge it, and it needs to be included in reporting. If there's an exchange, and it can be discounted tickets or real estate or any other financial transaction or transaction that could be valued, that is between folks affiliated with the organization, that is not available to people outside the organization, that counts as of concern. If it's valued between $500 and $5,000, it doesn't mean it can't happen. It just means it has to be reported to the charitable trust for the state and approved first and foremost by 2/3 of a disinterested party on the board. Some examples where I've seen this happen, that a board member is a realtor and rents or a property owner and rents a office space to their organization, right? So as long as the rest of the board says it's okay, and they would say it's okay based on, is anybody being unjustly or unfairly kind of accommodated here, if they're not, if it's fair, above board, it's market rate or close to, it's the best choice, or it's the best choice because, then it's allowable. If that value, and it's over a year, it's not a per exchange, so we couldn't have some sort of exchange 42 times at $5,000 and say we weren't concerned, then we need permission to do that from the charitable trust, and we need to file a public notice. So those are really the elements of the duty of loyalty. It's basically no insider trading in nonprofit language. The final big duty is to duty of obedience, and this always makes me twitch a little bit. Just the term obedience sounds silly when adults are talking about it. You can really interpret obedience as compliance. You have a duty as a board member to ensure, or be aware of and ensure, that the organization is making decisions in compliance with the organization's missions and goals. So it's not obedience to an individual or a group of individuals or even a state entity. It's obedience to the organization's purpose. That means know the organization's mission, understand the relevant laws, which we've kind of talked about. When and where do we report? The IRS, the Secretary of State for New Hampshire, and the Charitable Trust Unit. And it's kind of in that order as their levels of responsibility. The IRS certifies us as a nonprofit. The New Hampshire Secretary of State certifies us as an entity, and the Charitable Trust Unit certifies that we are doing the work we say we do with the budget that we say we're doing it with. Any questions so far on these 3 duties that I almost feel like folks should get a crown and a scepter and a cape around? It's kind of archaic language. This is a list of things that it's a little bit easier to understand in today's language. Out of those duties, they look like this. So these are the things that the board is asked to focus on. And we do that through a couple of different paths. The primary path is through board meetings. We currently have the monthly. They're currently on the 3rd Thursday of every month. There is room once when we meet in December, which is this Thursday, we will talk about, does that schedule still work for everyone? That's always the hardest part, frankly, is making sure we can find a time where folks can meet. We do have bylaws that are in the document that I sent out earlier, the board member orientation document. We have the big section. This is just another way of saying what we've already said in the mission and the vision. So that we can look back at that and say, well, maybe and these are the tools that we use when we make a decision or we have discussion about what should our work look like. Should we look at this sort of grant? Should we look at this sort of partnership? So these are the tools that I use for that first scan, and the perspectives that the board uses to kind of evaluate my decision making as well. And this last one is really the equivalent of all other duties as assigned or expected that you've probably all seen in your own job descriptions: to do and perform such other acts as the association may deem to be in the interest of public health of the state. So if you remember nothing else, remember that we've got some latitude there, and we can really focus on what we think is going to have a positive impact on the health of folks in the state. We are an affiliate of the American Public Health Association. This gets confusing for folks. It's still a little bit confusing for me. So I'll walk you through my understanding. Denise is also an active connection with APHA. Everyone who is an NHPHA member has the option of also becoming a member of the American Public Health Association, but it is not required. Folks may also become a member of the American Public Health Association without becoming a member of their state association. So they can be, you know, mutually exclusive. We try to encourage folks to become members of both. We're currently working through how to do that a little bit differently to increase the number of folks who make that choice, because the APHA membership is not cheap. But they have, you know, as the organization that represents all of the state associations, which they call affiliates, and it took me a while to figure out what that even meant. They have the same conversations that we have at the state level at the national level. And they will work with the CDC more directly, with the NIH, with the American Medical Association or the Pharmaceutical Association. So they're doing the same things that we're doing: education, advocacy, workforce, out of support at the national level. If folks have ever met Jeannie Holt, she is a longtime member of the New Hampshire Public Health Association, and she just completed her, she ran as for the APHA president position. She was not elected, but she's very involved with the American Public Health Association and travels around the country doing kind of equity-based strategic planning for many public health associations and other organizations, but we have some connections. There's a whole complex, convoluted governance structure within APHA as well. But we do connect with them because they have resources around policy statements and learning resources, things we can offer for professional development. If you belong to any other professional organizations that have a state chapter and a federal presence, it's pretty much the same version. So we do have there is an APHA orientation that they've done recently that they've made available as a recording. It hasn't come out yet, but when it is, I'll share it with the entire board. It's something folks may find interesting on their, when you're, board in 2028 at some point. So that's kind of the structure the organization works in. What is the structure of the organization? We currently have 10 members plus you all. So we're up to 14. We have a president, a vice president, a secretary, a treasurer, and we will be, I believe, Denise, right, working on a president-elect, which we have not had because the board has been focused on managing, doing some operational work, and it just didn't rise to the level of priority that some of the other things did. So this governance approach, again, is kind of evolving and maturing to meet the needs of the organization right now. Board members serve a 3-year term. You can serve up to 2 3-year terms. Anything is waivable. Denise has been here for probably what feels like 400 years, and we hope that she'll stay for another 400. But these are if you're going to bend or adjust the kind of guidelines, first you need to understand what they are. So this is what the bylaws say. We have board committees that are identified in our bylaws. They don't always get formed and recognized at the same time. They don't always operate at the same time because the organization doesn't always need them all. Our current standing committees are the finance committee, which has kind of been the longest term intact. the policy committee, which was very strong for a while, and then during the last administrative period didn't have the same role, and we're rebuilding the policy committee. There's a newly stood up communications committee and
All
a
right, Tori,
membership.
that sounded wicked sketchy.
Which part?
The policy committee. We hired a lobbyist to work for the association, so we disbanded the policy committee essentially.
Yeah.
And so we got rid of the lobbying firm because we realized that they weren't really working for us that great. So now we're reinstituting the policy committee.
Yes. Yep. Yep. And that is really what happened. Yeah, what I should say, I joined the organization in May. You know, I had been a president-elect for the board in 2020, came into that role a few months. I think we probably, a few months after NHPHA hired a new executive director, the long-term part-time executive director had been Joanne Ashheim, fabulous, had worked for DHHS for a long time, but was really ready to give retirement a more successful try. So she wanted to step down from the part-time executive director role. The grant funding was increased, so the role became full-time. There was an executive director that had been, she was a pharmacist. She had been working with the integrated delivery network in the North Country. Her name was April. She also really fantastic, stepped into the role, was there for probably a little bit less than a year. And at the tail end of, you know, during her tenure, I was the president-elect. Then she decided to make a career change. The most recent executive director before me was Hanan Bedri. She was hired right at the beginning of COVID. And our styles are very different. So I stepped back from the president-elect role so that I could do a different work during COVID, and she could do the work she was hired to do. She left the organization after about 2 years, almost 2 years, I think, in April of this year. And it was what the industry would term a no-notice departure. So the board was effectively running the organization for a few months, brought me in on a kind of contract basis. And as we sorted things out and got reorganized, we've now decided to move forward with me in that role. So some of these things are things that existed before and then didn't exist during Hanan's tenure, and we're revisioning now because different place, different time. Some of these things are plain old new, and some of these things have been going on the whole time. Don't worry if you can't tell the difference. It's useful historical information, but not terribly necessary moving forward for you to know which is which. So the board committee piece, there weren't, the only board committee per se that was meeting regularly was the finance committee. The board has decided to stand up these other 3 committees and have at least 2 board member representatives on each of those 3 committees as kind of the core, as the co-chairs or shared leadership for the infancy of the committees. The committees are just starting to meet. I will make sure you all get kind of definitions of kind of here's the scope of each committee, and we invite you to participate in one. It's our hope that you do. It's not a requirement at this point that every board member be on a committee. We may get to that point, but it's more important now that we have folks who are interested and have the capacity to engage. Then we have a measure that says we have 100% board engagement in committees. So it's kind of the way the entire organization rolls. The committees, especially policy, is open, will be open to anyone. You don't have to be a member of NHPHA. The communications committee is likely to be smaller and more selective about, yeah, you really should be a member of NHPHA if you're going to tell us how to communicate with NHPHA, but there is also room for folks to come in and provide guidance and feedback who are not members yet. And the membership committee is pretty solidly made up of folks who are already members, because they're the best ones to speak to what else can we do to build out our membership. And then the entire board oversees my work, the executive director's work. What is that work? So we have a couple big chunks of money, and those big chunks of money influence where the work is. At one point in time, prior to COVID, there was, you know, a budget of closer to $350,000 because of the funding that was available at that time. As everyone knows, I think the funding streams have gone wonky in the last couple of years in terms of what they've been directed toward. We can see some of that recovering, but there's still a lot of uncertainty around what the federal guidance will be and what funding will be available. And I think we can all acknowledge that there's likely to be some austerity in both kind of available funding and some constriction of supported work in the public health spaces. We just don't know what those details look like yet. We have received every year a very generous contribution from the New Hampshire Charitable Foundation and from the Endowment for Health, $75,000 apiece for its unrestricted funding. Their expectation is that we use it in pursuit of our strategic priorities, but the deliverables are ours to define. We receive about $7,000 every year from the New England Public Health Training Center. That funding is primarily designated for workforce development, professional development, and training. We also receive revenue from fees, membership dues, and a couple of years ago, there was an effort to develop NHPHA branded swag, which was very cool. We did not get that, kind of becoming a store took a back seat to the other work that the organization did during the real deep COVID work. My hope is that we can change that because it's kind of fun. We do have a new website that will make that much easier to manage. So those are the big chunks of the funding we currently receive. We are also constantly writing for new opportunities. We did just receive notice that we received a $5,000 grant from APHA to do some work around our organizational capacity. Are we a DEI savvy organization? And we're going to get some help being an organization that we're going to look at our own policies and our own procedures and all of that sort of stuff. So those are other opportunities that come up. We discuss them at the board level, and when that time is available, we do also have the capacity to serve as a fiscal agent for other entities that may be interested in their nonprofits, their mission or vision or focus or work is aligned with public health, but they may not have the administrative capacity to stand on their own. The Oral Health Coalition is a good example of that. We were the fiscal agent for the Oral Health Coalition for a long time. They do work similar to ours, but very specific around oral health. They've recently become their own 501c3 because they were able to show the track record of good work in New Hampshire. And so now they are down the hall and their own entity, and it's really neat. So that is another role we can fill. This is just kind of a breakout. This was the way things were sorted in 2021. The fiscal sponsorship was fees that we received from the Oral Health Coalition. That piece has gone away. So this is not specific to our current budget, but it's a general representation of how things look. And then that money funds what we do, right? So we have a strategic map that was developed about 3 years ago. We have not updated it, but we will be. It will be the work of 2025 because it's that time again, right? We have 4 strategic areas. The first is diversity, equity, and inclusion. The primary responsible parties for that are the board and the director. And there are some specific strategies that we have identified as our work in that space. The new one is to ensure that NHPHA is walking the talk as far as JEDI goes. That's justice, equity, diversity, and inclusion. To give you some examples of how we do that, part of our unrestricted funding, it goes towards supporting the equity task force. Folks may have heard of that during COVID, the COVID equity task force. NHPHA supported that convening to make sure that we were paying attention to issues around inequity that might be popping up as a result of different practices or policies in the state around vaccination, around illness, around prevention, that we subcontract to the Southern New Hampshire Area Health Education Center with Paula Smith. She funds work for Dr. Trini Tellez and Kirsten Dursey to lead that monthly equity task force coalition. That comes out of our unrestricted funding. Yeah, so that's an example of how we use our grant funding in the pursuit of our mission and vision according to our values in this strategic program area. A second strategic program area is to ensure that we have a high performing organization. This is a bit of a holdover from early funding from the Charitable Foundation and the endowment. They are saying, yeah, do good work, but make sure you're doing it well, right? Do you have good governance? Do you have good policies and practices? Do you have a strong organizational infrastructure? That's one of our goals. The board committees and I are all responsible for that work. Our third area, and probably the one that is most visible to folks who are not on the board, is championing public health policy. And that is very broad. It means a lot of different things. We really have 2 seasons of this work. The first is the legislative season, December to May, where we just stick our nose in and around what's going on in the State House, what's going on with the legislation that's been filed, communicating to members, calls for action, promoting literacy around things we might be concerned about, and participating with our partners like New Futures and NAMI around other issues as well. And as Denise said, we had a public policy committee. Then we had a lobbying team from a Concord-based lobbying firm. And now we are returning to a public policy committee, but we are investing in a communications firm because we recognized that the lobbying itself is not really where the information sharing needs to happen. If folks know, we've got one of the largest legislative bodies in the world. They're fairly homogenous historically, and I'm sure, Rich, you know this better than anyone. It's very, very difficult to move anybody in the current political environment. So one of the strategic perspectives we're taking is that, yes, we want to still be, develop our role as a trusted entity and source of information for legislators at the state level, but there are an awful lot of local level policy and decision conversations that are made in municipalities with planning boards and zoning boards and city councils and boards of select people that can also be maybe even more easily influenced if we can get our members and the general public the right information at the right time around things like PFAS or vaccinations or the impact of masking or housing policies. So those sorts of things are where this happens. The June to November period, when the legislature is not in session, we do some different work. And one of the most important pieces here isn't on this slide, but it's building partnerships, making sure that we are at the right tables to be considered kind of subject matter experts in or pathways to finding expertise in what can be some really interesting public health spaces. The last area of our 4 strategic priorities, professional development. While we don't currently have a specific workforce grant, a good chunk of our unrestricted funding, and one of the areas that I look for additional funding in is workforce development, because public health touches every place. We have a lot of workforce challenges. We have a lot of empty positions, and public health is a system of systems. And when you have lots of gaps in the workforce within those systems, the system that they're all a part of doesn't work very well. So prevention, health promotion, where and what sort of support can we lend into building the workforce there? Community health workers is an example of a new kind of public health adjacent role. We supported and were actively advocating for legislation, and it ended up being in the big budget bill during the last session, for community health workers to be reimbursable because they do diverse work, right? In public health spaces. We also do some mentoring and early career development stuff here as well. So we've had some larger events. We used to do an annual Team Up Take Action conference with Vermont. They've had some changes in their public health space. We're now looking to make that a collaboration with the Vermont and the Maine Public Health Association for professional development training. We usually have an annual meeting in April every year, and we do a bunch of webinars. It's been primarily webinars in the last few years, but there's always an opportunity to do in-person training as well. Part of that work is in communications, and we support some specific programs. That equity task force, we have facilitated the birth and infancy of the Vaxwell immunization coalition. We're in the process of doing an evaluation of it right now. It looks like we will have some recommendations to reorganize it come the next year, and part of our unrestricted operating funds will go towards that, because the grant that allowed us to stand it up and operate it has expired. Then that's kind of the life cycle of the work that we do. So I have 2 more slides, and then I will take, I'm sorry to put us so close to the end of our time together for questions, but we do have a lot of partners that we work with. They're here, New Hampshire's DHHS. We exist partly as an entity that is not the department. The department's got public health priorities. We are not necessarily aligned with them 100% of the time. Our members are our first priority. What else is going on in and around the state with folks who are looking for support, information, they have concerns? Can we amplify them? Do we have ways to convene and bring folks together to talk about stuff that nobody else is talking about? And the real partner group that we are looking to develop stronger relationships with in the coming year, 2 years, are the regional public health networks. Their work has changed a lot over the last 10 years, and we will absolutely be talking about that some more. But I appreciate that everyone took the time to come together today, so I will stop there and ask if there are specific questions, general questions, anything I can clarify, anything that I didn't cover that you would like to know more about. Please jump in. And Denise, do you have anything else to add that I didn't cover? That I'll start with you. What do
No,
you
I
wish
think
you
went
knew
through it.
as a new board member?
Ooh. I think you went through it pretty well. The only thing I could really highlight is that, we're establishing these new committees, these subcommittees. And so being at the, base level on these committees, it'd be great to have you join if you have any interest in any of them. But yeah, you really went through it well. Good job, Tori.
Other questions from folks? Anything I can clarify? And this was meant to be a broad overview, and certainly there will be no quiz on it, just to give you a foundation for kind of who we are and how we operate.
Yeah. And the only other 2 cents I would throw out there is when you get the financial report, don't let that freak you out. It'll take you a little bit to get used to how we do the layouts, but once you figure it out, it'll be like super easy to follow. So.
That's a good point. When you do get you'll get a board packet in advance of every meeting. You'll probably get it tomorrow. The goal is to get it to you a couple days ahead of the board meeting, which will be Thursday. So I wasn't very successful with that goal this month because we have it's shorter window. Schedules are weird. But that board packet will include an executive director report where I tell you what happened in the previous month. Before the meeting, you get a financial report, and we'll walk you through that. And if you want to do a finance kind of come together, we can do that too. The short thing to know is that we have money, we're spending money, and we make money, and we're stable. And you will also get an agenda, and you get is there something else that I send out now that I'm thinking about it? I think that's the
Pretty
core.
much it.
Yeah, that's the core. You'll get that packet. So, yeah.
I'd like, Tori, I wonder if I could step in and just say, how do I join the policy committee?
You just did.
See how easy that was? We really
That was-
make things accessible around here.
Absolutely.
That was easy.
Yep. So that committee has not, did it? Yeah, that committee has had their first meeting, and I have a summary of it to go out, Rich, and I'll just tag you into that. And we have not scheduled a second meeting yet.
Okay, thank you.
I was going to ask about the policy one, but prior to that, I just wanted to know how, like, what the modus operandi is for the subcommittees, so that I can know the level of commitment I can pursue for the policy subcommittee. But I just wanted to know what that looked like before I commit to it,
Yeah.
because I'm really interested in policy. I have been.
So I don't have a good answer for that yet.
Okay.
The committee has met once. There has not yet been a decision about how often to meet. I would expect maybe an hour. It's ranged in my experience, everything from weekly, an hour weekly to an hour a month to an hour quarterly. So I think whatever time I would encourage you to join and attend when you can. And inform that conversation. The board meetings are an hour and a half once a month, with whatever time it takes to read the materials. They're not dense. It's not New Hampshire Executive Council level stuff. You're not getting thousands of contracts every 2 weeks. So I think it's probably a 2 hours a month for the board role, and then there will be some variation. The policy committee is likely to meet a little more often during the legislative session and not so often outside of it. The communications committee is likely to follow a similar schedule, but I can't speak to a time commitment yet because the communications committee has not had their initial meeting. And I think they're open to kind of laying down a base and then kind of accepting whatever support folks can give them in whatever time frame.
Okay, so generally, how does the different committees, how do they work together with New Hampshire Public Health Association as a whole?
No idea, because we are just starting these new. Right, there'll be committee reports at the board member at the board level, but we don't have. I know, Denise, you want to.
Yeah, I was just going to say, at our last board meeting, we decided to reissue these committees.
Yes.
So we're literally at that starting ground of developing, the committee rules and the associations and, how we function, as a group in coincidence with the association as a whole. So
Okay.
we don't have a lot of those answers. But as far as the policy committee, in my personal perspective, is some of our membership will have expertise in some areas and not in others. So you'll end up participating in some, but not in others. And so you'll end up being able to pick and choose when and where you'll want to participate based on your comfort levels.
Gotcha. Thank you.
Did that answer your question at least?
Yes, it
Try to give
did.
you a
Thank
little bit
you.
of
It
focus.
gave me like a
Yeah,
yes,
we're
a
literally
passing.
starting
Yeah.
out, so we haven't named any heads to any of the committees. We haven't done anything in that manner because we're just trying to figure out the scope of each committee. And then once we have that scope, we'll be able to know how to function from that point forward.
From that point too.
Yeah,
Okay. Thank you.
yeah.
Any other?
Any other questions? I know we're not that good.
It was so much that folks are just like, yeah, this was a great idea.
They're just stunned, deer in headlights.
I know.
I thought this was a great overview. I don't have any questions at this point, but
Yeah.
you both seem like very open to questions throughout.
Absolutely.
So if something comes up, I will be sure to send you both an email.
Oh
That'd be
yeah,
great.
absolutely. Just hit us up.
Yep. Yeah. So
Yeah.
what I will also do, I'm in the process of doing a list of board bios so that you'll have the contact information and a little bit of info about the other board members. One of the things that I found hard for me was not knowing other people's, a little bit about other board members on boards that I've been on until months later, when it would have been helpful to know sooner. So that's one of the tools that we're building. And we haven't shared it with you, not because we're hogging it or gatekeeping, but it's not done yet. And we'd like to include kind of your bio information as well. And I'll be reaching out with kind of here's my recommendation of what we say based on what you've already given me. My role is to make this as easy for you to do as possible. To be a board member as possible. Be a resource, be a source of information, and help answer some of these questions, make connections, and sometimes just be a noodle partner. Let's talk about it. Let's think about it. You've got a question about public health stuff. Is there a place that I know of in the state where that conversation is happening, where I might be able to connect you, or your recommendation that we be more connected as an organization? So those sorts of, please don't ever hesitate. It's rare that I say, I know nothing and I don't know how to help. Most of the time I can send you to some place where someone knows more than me. So I will send out the presentation today, and you'll see the board documents. As Denise said, don't panic. Our treasurer is great, Scott Powers. And if you find after reviewing any of it that you want a powwow around the financials, happy to do that. And we can go from there. But the finance committee is Scott and Denise right now. That's also an option for folks. And they attend to the financials first, and then Scott does kind of the report out at the board meetings.
Right. But this Thursday, Scott won't be there.
Yeah.
So I don't know who, Tori, you'll end up doing the reporting out.
I think I caught your woolly coo.
My woolly coo disease.
Yep. Yep.
So, but yeah.
So
You'll find that
welcome,
we really
everyone.
operate a really open board, and we really try to, build a relationship with each other in order to accomplish all this work.
So we welcome to everyone. Thank you for taking the time today. Jennifer, thanks for making it. Do you want to take a minute and just give us a brief introduction? I know you couldn't join us at the start, but I really appreciate you hopping on.
Sure. Yeah, it looks like you're recording this, so I appreciate that. Sorry, I had a work meeting at 3, so couldn't get on the call from the beginning. And it sounds like there's a lot I need to catch up on, but really excited to be on the board and working with you all. I'm Jennifer Mandelbaum. In my day job, I'm a researcher at a health tech company in Boston called Athena Health, and I study trends in the healthcare system, like emerging technologies like AI, topics like physician burnout, value-based care, and things like that. And then I am also a member of the New Hampshire House of Representatives, so would love to be involved in some of that policy work too, unless that might be some sort of conflict of interest. I'm not entirely sure. But yeah, like I said, really excited to be working with you all and to catch up on the first part of this presentation.
Great, thank you, and so welcome to you as well. And we have historically in the policy committee welcomed anyone who wants to be involved, and the more elected folk we have join us, the more we learn. So really excited and looking forward to that. It's the first time I've said that about this upcoming legislative season. Might be the last time, but I did say it, and it's
Gonna
recorded.
be an interesting one.
It will. It absolutely will. So thanks, everyone. Please don't hesitate to reach out with questions or to call anytime. At some point, we'll do a in-person tour of the office. I could probably even do a little video and blink and you've seen it. But we'll help me help you get acclimated and anytime. And Denise as well when she's not infected.
With Willie Coo.
Willie Coo.
That's what we're calling it for right now, until the doctors actually give it a name.
Oh, there's your name. So,
Yeah.
all
I
right,
love
thanks
being
everybody.
patient zero.
I appreciate you taking the time. Please have a very good rest of the day.
Thank you.
Thank you
Yeah,
all.
great to see everyone.
Get
Feel better,
better.
Denise.
Feel
Thanks.
better,
Have a great
Denise.
day. Bye.
Bye-bye. Thanks, Tori.
Thank you.
Well, just us. Fantastic job.
You okay? Yeah, I'm worried
Yeah,
about
I'm
you.
surviving. I'm really disappointed about missing yesterday, though.
Yeah.
I was
Yeah.
really looking forward to that, honestly.
I think I haven't seen the materials come out, but the most important thing, the most valuable thing will be, I think, the work that Philip did.